Almost all child deaths in low-income countries are caused by three very dangerous illnesses: pneumonia, which is a serious chest infection; diarrhoea, which is loose stools; and malaria, which is caught from mosquito bites. This film will help you understand when your child is very ill and in need of urgent medical attention. It will also explain how to identify and prevent pneumonia, diarrhoea and malaria. Here's our expert to explain more.
Children of all ages are at risk of severe illness which can lead to death. If you notice any of the following signs, you must immediately take your child to a health worker. The signs that you need to look for are difficulty in breathing, no interest in drinking or breastfeeding, vomiting, a dry mouth and cracked lips, very high or very low temperature. For example, does your child feel much hotter or colder than normal? Pale skin, blue lips, irritable or upset behavior, unusual sleeping patterns, unconsciousness, which is when your child cannot be woken up, fitting, or violent shaking of the body and limbs or arms and legs.
My baby had blue lips and I didn't know that this is a problem. The community health worker told me to go to the hospital.
My daughter didn't do breastfeed. It was unusual for her, but I didn't know it was dangerous.
If your child has any of these signs, you must immediately take them to a health worker. And remember, even if you think your child is ill, then you must keep giving her fluids such as breast milk or other safe fluids like cooled boiled water. If she feels cold, wrap her so she is warm. But if she feels very hot, don't wrap her at all.
So now we understand the signs of serious ill health in the child. We're ready to learn more about the individual illnesses. We'll do this by going through pneumonia, diarrhoea and malaria one by one. Firstly, we're going to learn more about pneumonia. This is a very serious chest infection which makes a child cough and have difficulty breathing. The infection can spread through the body and cause the child to die. Here's our expert to explain the warning signs and symptoms of pneumonia.
Check to see if your child is breathing much faster than usual, or if her chest is moving inwards when she breathes, which is called sucking in. Another sign of pneumonia is nasal flaring, which is when the child breathes in and the nostrils flare outwards. You should also listen for any unusual noises your child might make when having difficulty with her breathing. Many children with pneumonia will make a noise like this when they breathe out. This is called grunting. If you hear this noise when she breathes out, take your child straight away to get medical help. Your child might make this noise if she's having breathing difficulties. This is called stridor. Or like this sound, which is called wheezing. These sounds do not always indicate pneumonia, but they are still very serious problems, and you must take your child to a health worker or nearest health post at once.
Now we know the signs and symptoms of pneumonia, let's learn how to treat it.
Drugs called antibiotics are used to treat pneumonia and make your child well again. It is very important that you give your child the exact number of antibiotic tablets the health worker prescribes and for the exact number of days she instructs until the packet is finished. Otherwise, the pneumonia may return. And if your child's condition gets worse during or after the treatment, you must take her back to the health post.
How can we reduce the risk of getting pneumonia and other breathing infections or difficulties? Let's find out more.
Breastfeeding your child for as long as you can may help to reduce the risk of a child developing pneumonia. This is because the mother's milk helps improve your child's protection against many illnesses. Vaccinations will greatly reduce the risk of your child catching pneumonia, so please ensure she has her vaccines and immunizations on time. Washing your hands with soap and water before handling your baby, especially if you have been with another person's baby, will help prevent germs that can lead to pneumonia. Keeping your child away from people who smoke cigarettes will keep her lungs strong and healthy. And finally, try to cook outside, or if you have to cook inside, then keep your child away from the smoke.
So now we know how to check for the symptoms of pneumonia, treat the condition, and most importantly, prevent getting it in the first place. With this information, we can help keep our children in good health. It's time for us to learn more about diarrhoea. This is another life-threatening disease.
The main sign of diarrhea is very runny or watery stools or poo. If you notice any of these signs, your child may have dangerous diarrhea. Look out for low appetite, fewer wet nappies or less wee than usual, and if your child is also vomiting, then the diarrhea is even more dangerous. If you see any of these signs, then also check to see whether your child is very hot. You can check this by feeling the forehead or body. Do not feel the feet or hands, as these can often be cool even with a high temperature. Sleepy at unusual times, coughing, or having difficulty breathing. Diarrhea can lead to dehydration, which is when your child has lost so much fluid that the heart is in danger of not having enough fluids to pump around the body. Check if your child is dehydrated by looking for a dry mouth and cracked lips, sunken or hollow eyes, restless or irritable behavior, unusual sleeping patterns, fewer wet nappies or less wee than usual. You should also pinch the skin on your child's tummy. If the pinched up skin takes some time to become flat again, this shows your child is dehydrated. Next, feel the hands and feet. If they are cold, then your child could be very sick, especially if it's a young baby. Also, check in the nappy for blood in the poo or stools. Offer your child fluid and watch to see if she's keen to drink or is she not able to drink. If your child shows any of these signs of dehydration, then take her straight away to a health worker. If she's drinking well and keeping the fluid down, give her frequent sips of oral rehydration solution, also known as ORS, which you can get from a health worker.
My son's eyes looked sunken. I knew that he needs fluid, so I should get in medical center straight away.
My daughter has a dry mouth and lips. This means she is very ill, so I need to take hospital.
My daughter had a loose stool in her diaper more than 1 week, so I took her to the nearest medical center to treat her.
Now we know the signs and symptoms of diarrhoea, let's find out how to treat it.
Dehydration must be treated by giving oral rehydration solution, also known as ORS. Your child must drink this every time she has a loose stool or poo. You can get this from the health worker or nearest health post. Make this drink by mixing 2 packets of it in clean, boiled water that has cooled down. After each loose stool, your child should have a quarter to half of a bottle of the drink if she's under 2 years old, or 1 to 2 bottles if she's over 2 years old. As well as giving ORS, you must continue to feed your child. And if you can, give her zinc, as this will also help with their diarrhea. You can get zinc tablets from your health worker. They come in 2 sizes, 10 mg and 20 mg. If you are using a 10 mg tablet, give 1 tablet to babies under 6 months, 2 tablets to children over 6 months. If you are using a 20 mg tablet, break the tablet into 2 halves and give 1 of these halves each day to babies under 6 months old, and a whole tablet to children over 6 months old. Sometimes diarrhea will last for more than 14 days and can cause malnutrition, which is a severe lack of food. If this happens, then take her back to a health worker or health post as soon as possible. As we have said before, diarrhea is very common and also life-threatening. You can make it less likely your child will get serious diarrhea by always washing your hands with soap, washing and preparing food with clean hands, breastfeeding for as long as you can, making sure all water used is boiled, cooled and stored in a clean, sealed container, preparing food away from the toilet area, taking zinc and vitamin A supplements, making sure your child has all her vaccinations.
You should now know how to recognise the symptoms of diarrhoea and how to treat it, but it's very important to try to prevent it in the first place. Doing this could save your child's life and the lives of many children every year. Now it's time to learn more about malaria, a dangerous disease that is caught from mosquito bites.
If your child has a fever, take them to the health post at once. Fever may be caused by lots of different infections, including malaria. Malaria can become very severe in less than 1 day. If this happens, your child is at risk of death. She may have fits. This is when a child shakes without control and becomes unconscious, which is when the child cannot be woken up. To see if your child needs to be taken to a health post with suspected malaria, firstly check if the child is very hot, has unusual pale skin, tongue or gums, yellow whites of the eyes. They may also have joint pains. If your child has any of these, then she could have malaria or another serious infection. You should go to the health centre for a blood test which will confirm the illness and where they can give you medicine to start urgent treatment. You should also check to see if your child has a cough, difficulty breathing, diarrhea, tiredness, sickness, a stiff neck, or a low appetite. If you see any of these symptoms, it could mean your child has a very severe malaria or possibly another serious illness as well as malaria. Your child may also need other treatment and might need to go to a larger health centre or hospital.
My daughter was tired all the time. This means she had a malaria or anemia. I have to take her to hospital.
My child have a fever which coming and going. I knew that it could be a malaria and it can be treated easily.
So now we know the signs and symptoms of malaria. Now our expert is going to tell us how to treat it.
If your child has any of the general warning signs mentioned in the beginning of the film, or has a stiff neck, or has a fever for more than 7 days, Then she has a very severe disease with fever. Take her to a health post straight away. If you can, quickly find a health worker who will give your child a malaria medicine whilst you're on the way to the nearest health post. They may also give you another medicine called antibiotics to make your child better alongside paracetamol to help the fever. But you must still go to the nearest health post as quickly as possible.
As we've said before, malaria is a very common and life-threatening illness, so let's hear how to avoid catching it.
Malaria mosquitoes grow in standing water, so don't let water stand in containers like old tin cans or other rubbish that can collect rainwater. Use insecticide-treated nets. These need to be treated and repaired every year or they won't work. Understand how to properly use mosquito nets. Use anti-mosquito sprays in the home. Tuck the net under the bedding so mosquitoes can't get through and place over the child every night.
So now we know how to check for the symptoms of malaria, how to treat the condition, and most importantly, how to prevent getting it in the first place. With all this information, we should be able to keep our children in good health. Please remember that although we've listed each of these illnesses separately, signs of malaria can cross with other signs of other illnesses.
For example, a child may have malaria and a cough with fast breathing. The cough and fast breathing indicate pneumonia. In this case, the child needs treatment for both malaria and pneumonia. Children with malaria may also have diarrhea. They need an anti-malarial medicine and treatment for the diarrhea. Your health worker or someone at the health post will be able to explain these more complicated illnesses.
Now we know how to recognise the signs of pneumonia, diarrhoea and malaria, how to treat them and how to lower the risk of our children getting them. We hope that you remember the information in this film and keep your children healthy. Bye for now.